Namaste and welcome to the next episode of Clinical Ayurved. Myself, Dr. Mayuresh Agte. We were discussing Dipan and Pachan Karma. Actually, we started with that subject as a base, and on the background of this karma, we have discussed various other topics also. For example, Tiktaras, importance of Tiktaras, balancing of Tiktaras, indication of Katu Ras, etc. In that regards, I have put a case in front of you and I have asked you what is your diagnosis in this patient. And the case was patient has come to you. He complains now that his normal diet is 3 rotis and a good amount of rice, but since few days he is eating 2 rotis and half of the rice in his meals. What is the diagnosis of this patient? Now remember, there is appetite is less, so there is some problem with Agni. But is Agni is diminished like Jwara? No. There is no symptom of Amanirmiti, Udargaurav, Samajeva, Udgar, etc. So there is no Amanirmiti also in this patient, but his appetite is not normal or not up to the optimum level what previously used to. What is the diagnosis of this patient? Of course, the it is related with the Agni, and so Agni is reduced, strength of Agni is reduced, but no Amanirmiti as such. Good taste, good hunger, but quantity of food is less. And diagnosis of this patient is Pittakshay. In first year, we study physiology, Vata Pitta Kapha Vruddhikshay Lakshana. In that Pittakshay Lakshana, in Ashtang Hruday, they have mentioned Pittam Mandir, Pitte Mandonala Shitam. Pitte Mandonala, Pittakshay, and that's why Agni tends towards the lower side. Hence, no Amadirgiti, no any other symptom, but Agni is on the reduced level, indicates Pittakshay. So, what will be the treatment? Vruddhi Samane Sarvesham, Pitta Vruddhikaran. So, the properties which are Pitta Vruddhikara or Pachya Agni Vardhan are indicated. And which are they? Of course, Ushna Guna, Tishna Guna, Agni is Urdhagami by Lagu Guna. It is Tyatta Dravatva Pakadi, so Ruksha Guna. So, Dravyas having these guna are indicated for Pitta Vruddhikara Karma. Now, here there is Agni Sandukshan because he is eating 2 rotis. It is not diminished to a higher extent like Jwara. So, indication of Tikta Rasa is on the lesser side because there is already Agni Sandukshan and there is no Amanimiti as such. Katu Amla Lavana Ras, which are Pitta Vruddhikara having Ushna Virya, are the proper indication in this patient. In practice also, we recommend in such patients the normal home remedy. What we ask the patient to take some adrak piece, then put some lavada on the other and sprinkle some lemon juice, limbu swarasa, and this combination is called as pacha, and we ask the patient to chew it. So this Katunga lavada rasa will go inside the body and with Agnisaman Gunadharma they will increase the appetite which is reduced. So this is the case of Pittakshaya. Pitta Vruddhikara treatment is expected, Agnivardhak Guna are indicated, and here Katu Amla Lavana Rasa are more indicated than Tikta Rasa. So, this is the clinical explanation of such case. Now here I am discussing that patient doesn't have any other symptom than this. So there is no brumi, no grahani, etc. Plain just lower appetite. When a patient comes to you with this case in practice, you have to examine it, no doubt, physically, but when you will find that there is no any other problem, always keep in the mind that many a times there is some manasa hetu, worries, shock, or grief, or any stress gives impact on the appetite. Patient has hunger, but the quantity is reduced. Patient always tells you that भूख लगती है लेकिन खाने की इच्छा नहीं होती. Yes, I feel hungry, but my mind doesn't will to eat, and therefore in this case the manasa hetu are very much important, which is routinely found in the practice. Now, if a patient is having, there is no physical problem, and after taking the history or with some open up with the patient, and he is saying yes, I have such ration, that's why I am not able to eat in spite of my hunger. Now always remember, even a food which the patient likes is in front of him, he will hesitate to eat that also. So in such case, manasa hetu or manasik sthiti is very important. Now, if you have diagnosed that patient is having lesser appetite because of some manasa hetu, how you will put samprapti of this patient? Because on that samprapti, your treatment is will be there, will be choked out. So it is directly proportional to the manas hetu. So what will be the samprapti of this patient? Symptom, appetite is lower down, hetu, manasa hetu. So what is actually happening in the body of the patient? This is homework for you. Why this is important? Because in this case, only Kapila lavender will not be helpful unless you rule out the cause, and to rule out that cause and give exact clinical treatment, you have to write down what is the samprapti going in that particular patient. Homework for you. We will discuss this point in the next episode. Thank you very much.